Hello, everybody, and welcome to Care Talk. My name is Laura Packard, and I host this weekly show where we answer your health insurance and healthcare questions. So please text or call in your questions at 202 838 6837, and we'll get you answers in future episodes. And also be sure to subscribe to my channel or podcast wherever you get your podcasts to get your weekly Care Talk. And today's show, we're going to be talking to Tina Sherman, the National Director of Moms Rising Together and Moms Rising Education Fund, to talk about fertility treatments and IVF, what happened in Alabama recently, and what could happen next year, and how it will affect patients. This has been quite a big week for healthcare, and today we will turn to fertility. So, welcome, Tina.
Thank you, Laura. So glad to be here.
So tell us what happened in the Alabama relatively recently from the Alabama Supreme Court. So tell us.
Yeah, so the Alabama Supreme Court justices citing anti-abortion language that was added to the state constitution a handful of years ago that it protects the rights of an unborn child. And so what this did was allowed Alabama citizens, it limited their access, citing again this right of the unborn child, limiting access to fertility treatment. And what we know is that 40% of people say either they themselves or someone they know have used fertility treatment. So we know that struggling with fertility and needing that access is something that so many families across the country need. So when the Alabama Supreme Court did this, I want to back up a little bit. The Alabama Supreme Court did this on the heels of the Dobbs decision, which effectively overturned Roe v. Wade and the right to access to abortion. So folks are going to say, what does Roe v. Wade and abortion have to do with fertility treatments? In fact, some folks might even argue, are they in conflict? Well, no, because abortion is healthcare. And when we start talking about limits to abortion, limits to healthcare, we're really talking about limits. It really opened a Pandora's box of what issues both courts and lawmakers could attack. And so really fertility treatments was really sort of the first thing that we saw. But unfortunately, this Pandora's box is now open. And so as we look towards 2025 and the years post Dobbs, we're really looking at what other healthcare is in danger and what other healthcare actions what other healthcare will be under attack.
So in Alabama, after the Alabama Supreme Court made this ruling, there was a ton of backlash, and the Alabama legislature passed a law that supposedly protected fertility treatments. Is that right? So what happened in Alabama after this decision and after the law, and is the problem solved in Alabama or not?
It is not. So they did address it slightly, but left loopholes which, again, coming back around, really can cause problems in the future. And now, again, that Pandora's box has opened for a wide range of states to look and say, okay, we can look at fertility treatments and see, is this eligible? Is this something that should remain accessible for families? And so the Alabama, the Supreme Court did come back around, or I'm sorry, the legislature did come back around and address, but again, leaving those loopholes means that many families are still unprotected. And so this is not a right that is enshrined and protected now, and actually is a little bit of a template for other states to look at and to enforce, and not just states, but also the federal government.
And what are the consequences for people that want to start families in Alabama right now? And what could be the consequences in other states?
Well, we were hearing from Moms Rising members in Alabama and across the country where who were literally, we heard from one family who literally was in the process of fertility treatments, and they were mortified. They had embryos that were frozen, were going in, to receive, their next round of treatments, and had to stop right there. And so there is this fear that one, that could happen again, whether it be Alabama or anywhere across the country. And without having that sort of sure access, with this threat still hanging out there, because it is not guaranteed at the moment. And so, with this threat still being out there around whether Congress wants to or doesn't want to um, ensure that families have access to IVF. Our families are really kind of at the mercy of what Congress and the courts decide to do. So it's really we're really in a really tenuous place, and for families that are currently going through fertility treatment, it's a really, once a family has already made that decision to embark upon fertility treatments, that's an entire commitment, both emotionally, financially, and the uncertainty right now is unfair at best, um, harmful, and devastating and traumatic for so many families.
And I've heard that some clinics in Alabama have closed and have not reopened. So, right now in Alabama, can somebody get fertility treatments or is it kind of up in the air?
My understanding right now is that folks in Alabama can still access fertility treatments, but that access is now limited with the closing of with the closing of several places.
So, if other states follow this model, if other states, pass laws like the fetal personhood or have court rulings about this, then we could see fertility clinics close and people lose access in other states and fairly widespread.
That is absolutely, unfortunately, a potential. Absolutely. What Moms Rising would like to see is there be federal protections, so that there would not be any question about what families are able to have access to, and that everyone has access to the reproductive health care that they need. And if that includes fertility treatments, that they're able to have that access. And so we do have Senator Tammy Duckworth herself, whose family was expanded using fertility treatments, has proposed legislation to do just that. And that is one thing that we would love to see happen in the next Congress, is for this bill to come have a hearing and come to the floor and be voted on in both houses of Congress.
And what happens if somebody is in the process of fertility treatments and their state, a court or the legislature passes a bill that restricts access? So, what happens if you have embryos in storage or are somewhere in the process?
I unfortunately, I don't think we could answer that right now, and that's a really terrifying question for so many families. What does happen? Are those embryos destroyed? I I would hope not, and yet it's a terrifying question we don't have the answer to.
And as you were saying, that's why we need federal protection for your right to access fertility treatments. So I believe that this was a bill that folks tried to get through this year, and there weren't enough votes. Can you talk a little bit about why we don't have protections, access to fertility?
Well, I think that, again, when folks think about access to abortion, they don't think about abortion being healthcare. They think about abortion being this aside. They don't think about it being healthcare and all the implications that go to being able to have access to abortion and how that affects the full range of reproductive health. And so when we think about what has happened since the Dobbs decision, the attacks on IVF and fertility treatments are really just a small sliver of what has happened and what could happen. We're worried about contraception. We're worried about folks having access to the contraceptive methods that they choose, and that being an issue as well. And so, without without the restoration of Roe v. Wade, and the protections that were provided within that, we really are going to be in this place where there could be zealot politicians who really do not want families to have the autonomy to make the best decision for their families when it comes to reproductive health care. So one step in protecting IVF access would be the right to IVF, introduced by Senator Duckworth this last Congress.
And so, right now, if somebody is hearing this, regardless of what state they're in, should they be contacting their state legislators? Should they be contacting their senator and their representative in Congress? What should people do right now if they want to make sure that everyone has access to fertility treatments going forward?
Right now, make a call to your member of Congress. Or I'm going to ask if you all could put in the show notes our Moms Rising's action page, to encourage folks to reach out to their member of Congress, signing our petition, encouraging members of Congress to to pass and enact the Right to IVF Act. And this will ensure that families have the right to IVF and have that access uninterrupted so that these questions don't arise, so that courts do not come in, so the state legislatures do not come in and make it challenging for folks to have access to IVF.
So we need Congress to act on the Right to IVF Act, but that is just the start of protecting your reproductive rights and making sure that people can control when and how they grow their families.
Correct.
So, are there any closing thoughts you want to leave us with? What could happen next year? What should we be on the lookout for, either from our state legislators or from Congress?
I think next year is going to be a challenging year for reproductive health care, including IVF. I think that we are going to be on the defense to protect the rights for families to have access to the health care that they need. And I think it's going to be a hard year. And so I wish that I wish that I could feel optimistic about that, but I feel like we just got a little bit of taste of what that looks like with the situation in Alabama and the right to IVF. I think that we're just getting a tip of that iceberg, understanding that the full range of reproductive health care is under attack. And I am worried as we move forward, and I'm optimistic. We did have, folks rallied behind the right to abortion care in several states across the country. The majority of the ballot measures, when put to the put to the voters worked. We know that the majority of Americans do believe in the right to the full range of reproductive health care. So we know that when we rally together and organize together, that it is possible. But I think it is going to take that rallying, all of us pulling together to hold the line.
Thank you for joining us, Tina Sherman from Moms Rising. And in previous episode, we had Anthony Metzger from Planned Parenthood, and we will have a guest talking about your right to contraception in a future episode. And now we're going to answer some viewer questions on health insurance. So right now, open enrollment is still going on for the Affordable Care Act. So to talk about that deadline and what people need to do to sign up for health insurance, welcome Louise Norris of healthinsurance.org.
Thank you so much, Laura. Yes, so the open enrollment period for individual and family health insurance is still going on. In most states, it goes all the way until January 15th or even later, but December 15th, this coming Sunday, is sort of the soft deadline that people really need to pay attention to. If in most states, if you wait and sign up after December 15th, your coverage won't take effect until February. So there are a handful of states where there's a later deadline. And if you go, we have a list of that on the deadlines page on healthinsurance.org. But for the most part, the vast majority of states, you got to sign up by December 15th to have a January 1 effective date. And that's important for several reasons. If you are currently uninsured and you wait, then you're just starting the year with no coverage and missing out on the marketplace subsidies that you probably qualify for. Most people do. If you currently have coverage and you're maybe wanting to make a plan change for 2025, if you wait and make that change after December 15th, what's going to happen is your current plan will renew just automatically, which might be the coverage might change and the premium might change from what you have now. It's not just going to be keeping the same coverage you have in December. Things will change, but then it will change again when the plan you select takes effect in February, which means you'd be starting all over again with new out-of-pocket costs if you do have out-of-pocket costs in January. So it just gets complicated when you have two plans in one calendar year. So just enroll by this Sunday, by December 15th, to get yourself a full year of coverage on one plan with one out-of-pocket limit, one deductible. You can start by going to healthcare.gov. If your state does not use healthcare.gov, it will direct you to the correct marketplace in your state. There are 20 of those where the state doesn't use healthcare.gov. So it'll get you in the right place, and then you can compare all the plans. You can look and see what subsidy amount you qualify for and get yourself signed up. You just want to plan to do it by Sunday.
Thank you, Louise. And I just checked my plan myself. I went in and I made sure that I'm enrolled for next year, that everything looks good. So don't delay, do it this week. And our next question came in via text. This person wants to know, can you talk about how to navigate your network? Many healthcare systems are discontinuing services in the outpatient setting for patients who have out-of-network coverage. But many people don't understand what this means and where they have access to. And to answer that question, welcome Diane Archer of Just Care and Social Security Works. Diane.
Thank you, Laura. So it's a great question. And I think one of the challenges people face in our new HMO managed care healthcare system, I guess not so new anymore, is restrictions on access to doctors and hospitals. And for people with Medicare, I know it's about 2/3 of people with Medicare in a Medicare Advantage plan are in what are called Medicare HMOs, which limit their access or their coverage for care from to doctors who are in the network, except in emergency situations, they'll have coverage. So, and that means that if you're traveling, you're not covered. It means that if you need to see a particular cancer specialist or a particular epidemiologist, whatever it might be, and that specialist is not in network, you will pay fully out of pocket. So what I like to impress upon folks is that when you're in a for-profit managed care plan, or even a not-for-profit managed care plan in Medicare, and it applies outside of Medicare as well, you really are limited in terms of the doctors and hospitals you can see. What makes matters worse, as is noted, is sometimes things change. And so you think a particular hospital system or specialist is in the network, and then you blink and that specialist or hospital is not. There's no obligation for the insurer to keep a doctor or hospital system in its network for the entire year. Providers come and go throughout the year. So people try to protect themselves with what's called a PPO, which allows them to go out of network and still have coverage. If you're in Medicare, it gives you greater access to physicians and hospitals than you would have in a Medicare HMO, but nothing like the access you have in traditional Medicare, where virtually any doctor or hospital in the country is covered by the traditional Medicare program. With a PPO, you think you are protected and can see virtually any doctor with a higher copay. Usually it's about 40% copay, but that's actually not really the case. What's the case is if a doctor is willing to see you and take the rate that the insurer will pay, that's usually the Medicare rate. The Medicare Advantage insurer tends to pay the Medicare rate for out-of-network care. You can be billed as much as, I believe, 40% upfront. You will have to pay cash, and that can obviously be incredibly expensive for a specialized treatment, and over the course of a long period of time. But that provider needs to be willing to take payment from your Medicare Advantage plan or your insurer if you're in a commercial insurance plan, and they don't have to. That's up to them. So you're not able to have quite the access that you might think you do. Moreover, your insurer can still deny coverage through prior authorization when you go out of network. So this is all a very long way of saying that there are no guarantees as to your coverage if you're in a PPO, a Medicare Advantage PPO, or even outside of Medicare, a PPO. If you have Medicare, your greatest choice is always going to be in traditional Medicare, where you can travel around the country and get coverage wherever you are from almost any doctor or hospital. And there, Medicare pays 80%, and you're responsible usually for 20% coinsurance for physician services, but you can buy supplemental coverage to pick up those costs. So I just want to end by saying two things. First, that sometimes you think that Medicare Advantage will be less expensive, but once you start paying all of the copays or the 40% coinsurance for out-of-network care, it can be a lot more expensive than traditional Medicare. The good news is if you're in Medicare Advantage and rethinking what you want to do about your health care, you have between January 1 and March 31 of this coming year of 2025 to switch your Medicare Advantage plan, leave it. You can switch to another Medicare Advantage plan if that's what you really want. But again, there's a lot of risk about which doctors you're going to be able to see and whether your plan will cover your care. Or you can, during those 3 months, switch to traditional Medicare where you don't face those risks and you can see virtually any doctor and have coverage for your care. The cost of supplemental coverage is a couple $1,000 a year for pretty comprehensive coverage. You can buy less expensive coverage, but you will be guaranteed access to the care you need. And I think one thing we all forget is we're healthy today, but tomorrow, who knows? You can get hit by a car or fall off off the pavement, and you could get diagnosed with a serious condition and want to see, a specialist who is not in network if you're in Medicare Advantage. And the easiest way to be sure to see the specialists you need to see is in traditional Medicare.
Thank you, Diane. Our next question was actually a question that came up on Threads from Eunice, who says that my current healthcare premium of $21 a month is going up to $549 a month. This is my Affordable Care Act plan with United Healthcare. I shopped a lower cost plan, and even that one is $426 a month. So, Louise, can you give us some insight on what might be happening here and what folks like Eunice should be doing?
Sure. So, and Eunice did provide a little extra context in that thread discussion. She clarified that her income for 2025 is actually 60% lower than her income was in 2024. So almost certainly what's happening here is she is in a state that has not expanded Medicaid, and she's therefore in what's called the coverage gap. The ACA did not create a coverage gap, just to be clear about this. The ACA called for people to have Medicaid up to 138% of the poverty level, which currently that's a little under $21,000 a year for a single adult. And then above that, you would switch to having marketplace subsidies. There was no coverage gap in the ACA. But shortly after the ACA was enacted, the Supreme Court ruled that states could not be required to expand Medicaid as called for in the ACA. And the federal government pays for almost the entire cost of expanding Medicaid. But there are still 10 states that have refused to accept that federal funding to expand Medicaid. And in 9 of those states, there is a coverage gap because most adults do not qualify for Medicaid if their income is below the poverty level, but the ACA does not provide premium subsidies if your income is below the poverty level, because again, under the ACA, you were supposed to get Medicaid. So almost certainly Eunice is in one of these 9 states where there is a coverage gap. In those states, if you are earning less than, for 2025, if your projected income is less than $15,060, you pay full price for your health insurance. You do not qualify for marketplace subsidies at all. And unfortunately, you don't qualify for Medicaid because the state has refused to expand Medicaid. So if you're in a state that has not expanded Medicaid and your projected income for 2025 is below $15,060, you are going to pay full price for your coverage. So this is almost certainly a situation where Eunice was qualifying for a marketplace subsidy this year, but because her income has dropped, she is not qualifying for a marketplace subsidy next year. So if she can pick up some extra hours or a part-time job that just bumps her income for 2025 above that $15,060 threshold, then she will find that her subsidies, she qualifies for significant subsidies again. So that is almost certainly what's happening in this situation.
And just to reiterate, this is something that should not be happening. This is because those states refuse to expand Medicaid, and that means working people like Eunice are being penalized, that because they make some money, too much to qualify for Medicaid, but not enough to qualify for Affordable Care Act subsidies, they're falling into this gap. So this is preventing working families in those states from having affordable health care. And this is a choice by their state legislators and their governors, and they could choose differently at any time and cover the millions of Americans that are falling into this gap.
Absolutely. They could change at any time. A state could choose to, and we have had several states over the last several years have expanded Medicaid. that didn't do so initially in the beginning. So those 9 states could make a different choice at any point, and start to cover the people who basically have no access to coverage right now.
Thank you, Louise. And that wraps up our questions for today, but we will be back next week to answer more health insurance and more healthcare questions. So please text or call in your questions to 202-838-6837, and we will try to get you answers in future weeks. And also be sure to subscribe to my channel or podcast wherever you get your podcasts so that you will get the latest episodes of Care Talk. Thank you.